Hi, I'm Dr. Shashidhar BK from Bangalore Spine Specialist Clinic. As a parent and also as a patient, a diagnosis of scoliosis can be really overwhelming, physically and mentally daunting, particularly when you're not aware of the condition. Let's not worry. Today, I will make an attempt to break it down into more simpler concepts so that it can decrease your apprehension about scoliosis. So what exactly is scoliosis? Instead of being straight, if our spine is turned sideways with a C-shaped or an S-shaped curve, we call it as scoliosis when the degree of the curve is more than 10 degrees. You can imagine a coconut tree which is straight and the coconuts on top are all well aligned. Now if the tree is leaning to one side or if it is curved, the coconuts are all leaning to one side. Similarly, if the spine is curved or tilted, our shoulders and our head balance can be altered, where the mountain part of the curve, which is the C part, the shoulder can go up. The inside part of the curve, our shoulder can go down. This kind of balance can also affect the base, which is the pelvis. So a patient with scoliosis can have uneven shoulders, uneven pelvis or the hips, with one pelvis more prominent than the other, or a bump in the area where the maximum part of the C is there. Mothers or others can notice a bump over the back. It can also lead to uneven chest, with one side of the chest being more prominent than the other. Usually it is more of a cosmetic concern with uneven shoulders and uneven pelvis. But if the curve is very severe, it can also affect the vital functions like the functions of the heart and lead to breathing difficulties. So why scoliosis happens? Our spine is made up of multiple bones stacked on top of each other. If there is a problem in development of one of the bones by birth, this can lead to a tilt of the spine. Also, our nerves and muscles are very important in providing a balance to the spine. If they are involved, that can also lead to a tilt of the structure. This is known as a neuromuscular scoliosis. Many a times, there are many syndromes and many genetic problems which can also affect the growth of the spine. These cause what we know as syndromic scoliosis. For example, diseases like Marfan syndrome. Many a times, most commonly, we do not know the exact root cause of the deformity, where we call it as idiopathic scoliosis. So it can be congenital, it can be neuromuscular, it can be syndromic, or most commonly it can be idiopathic. How it is detected? Most commonly it is a close relative of the patient who has noticed a deformity over the spine, or many times the patient present with a new onset back pain, or we also have a screening program in the schools where we do the Adams forward bending test for growing children which can detect scoliosis. Once there is a clinical suspicion, we get an X-ray of the spine, which ideally should cover the whole spine with both the shoulders and the hips, where we can detect and quantify the amount of the curve. If the angle of the curve is less than 25 degrees, we usually observe the child. If the angle of the curve is 25 to 40 degrees, in a growing child, this requires some kind of bracing. Imagine a tree which is growing. While it is growing, if you give a support, we can direct the direction of the growth in an ideal way. Similarly, a brace will help the spine to grow into a more normal configuration. If the angle is more than 45 degrees in a growing child, we usually advise surgery. Or if the angle is close to 40 degrees and there is a significant cosmetic concern, we also address the same by surgery. We need to understand that most of the time scoliosis is affecting growing children. So our evaluation also includes the growth stage of the child. We need to know how the children grow. So children have growth spurts during which they suddenly grow in height. Now this sudden growth can also lead to a sudden increase in the angle of the curve. A child who was having a 30-degree curve during the peak growth spurt can suddenly have a 45 or a 60-degree curve. In a girl child, this generally happens during the onset of the menses. That is when they have their first cycle. In a male child, this can usually happen somewhere around 14-15 years when the child suddenly reaches or goes beyond the father's height. This is a very important time for regular follow-ups to see how the curve is progressing. So if you have been diagnosed with scoliosis around this age, then you need to see your doctor more frequently, and you'll probably have to get an X-ray also more frequently, because we need to catch them before they progress to be able to prevent the progression. The main goal of treatment once a curve has been detected is to stop the progression of the curve where they don't reach a significant angle needing surgery. So any child who has been detected with a 10, 20 or 30-degree curve needs a regular follow-up, regular X-rays under the supervision of a spine specialist. Unfortunately, despite of all the advances and availability of healthcare, some children still progress to a degree where they need surgery. So now let's know about scoliosis surgery. In a very young child who has got a lot of growth potential, maybe less than 10 years or less than 8 years, our goal is to prevent progression and also to aid normal growth of the spine. So in this age group, we use what is known as growing rods. These are rods which are aligned with the spine with some screw fixations. The rods have a facility where the rods can lengthen and grow as the child grows. So growing rods are like supports to the coconut tree, but the fascinating thing is even the rod can grow with the child. The children who have already progressed to 45 degrees, we do what is known as a spinal fusion with correction of the deformity. In these children, the goal is cosmetic correction to get a good shoulder and a pelvic balance, and also a fair degree of correction of the curve. We aim around 70 to 80% correction. Here, we put screws in certain crucial parts of the spine, align the spine well, align the shoulders, and use bone graft to fuse the spine in that good alignment. Scoliosis surgery has evolved leaps and bounds over the last few years. With enhanced recovery protocols, good anesthesia management, neuro monitoring, neuro navigation, the surgery has become safe. In fact, now we are able to mobilize the children on the same day or the next day of surgery. Hospital stays have become short. The child stays in the hospital for 3 to 5 days. Roughly around 6 weeks, the child can go back to the desk, can go back to the school. Around 1 year of time, the child can go back to the normal life. Physical therapy, physiotherapy and rehabilitation helps in enhanced and quick recovery. There is no surgery which is 100% risk-free. Like any other surgery, a scoliosis surgery also has risks and complications, which can be infection, wound healing problems. The body might not accept the screws, there can be screw loosening, fusion might not happen, but these are all in special situations. It is always good to have a fair discussion with your spine surgeon about the risk and complications. You need to understand, accept the risk, and then go for surgery. The key takeaway here is our understanding of scoliosis has improved a lot. The way we managed has become more polished. So if you have scoliosis, you don't have to be overwhelmed. I request you to please meet a spine specialist who is adept in dealing with scoliosis. Every child is unique. Every patient situation is different. It is important to be under regular follow-up under a spine specialist so that many times we don't reach the situation of spine surgery. We are able to prevent surgery in many children by providing braces at the appropriate time. Once you're diagnosed with scoliosis, it is important to follow up with the same doctor or the same specialty. If you have scoliosis, then you start doing alternative treatments, and then the child comes back to us with a severe curve. Yes, alternative treatments are important, they help, but it has to be integrated with a spine surgeon's supervision. So you can do both the treatments, but a spine surgeon supervision is required because we can prevent the curve from progressing, and we can also prevent surgery. Unfortunately, if a surgery is required, the outcomes are improved, patients are getting back to their life earlier and more effectively than before. Scoliosis surgery or scoliosis diagnosis is not to be feared about. It is to be taken care of as a team with the parents, with the spine specialist, and with alternative treatment options and physiotherapist. All the best.